Last lecture, we discussed the process of selecting particular interventions for individual clients. And there are a few models that can guide us in the process of treatment client matching. And we'll discuss two of those models today. Treatment client matching is the process of selecting specific practices or interventions to match client needs and preferences. This involves the use of decision rules or a series of questions that the helper constantly asks him or herself to match interventions to clients and their identified concerns. The first matching model that we'll discuss is the problem-solving model. And this model involves asking a series of questions to select interventions. The first question is, what is the likelihood that this particular intervention will achieve the specified goals? You, of course, want to make sure that your intervention selection is driven by the achievement of the goals you've identified along with the client. So you want to make sure that the interventions are likely to achieve those goals. Next, what is the likelihood that I, as the therapist, will be able to participate in, understand, and be able to carry out the strategy in its optimal form? So you'll have to reflect on things like your education, your training, your experience. Are you competent to carry out this intervention? And you have to also think about the things like, do you have the resources available to you to carry out the intervention? Do you have the time? So for example, if a particular intervention would require you to meet with the client for 2 hours every day, you may not have the time in your schedule, you may not have the capability to meet with the client that often for that long, so you may have to either select another intervention or maybe find another clinician or setting that can carry out the intervention in its optimal form. Number three, what is the likelihood that the client will be able to participate in, understand, and be able to carry out the strategy in its optimal form? So you'll have to consider a number of client characteristics like their motivation for change, their readiness for change, the resources available to them, their level of cognitive ability to understand the intervention, and you'll have to consider all of those things before deciding that a particular strategy is appropriate for that client. Next, what is the likelihood that collaterals or other healthcare providers will be able to implement a particular strategy in an optimal way? And so when we talk about collaterals, we're talking about important people in the client's lives. So things like, friends and family members. And so often those people could be either responsible for carrying out the intervention. So in the case of things like children or people who have caretakers, the collateral may be actively involved in carrying out an intervention. Or in other cases, the collaterals are just support systems. So you'll have to determine whether or not the collaterals are able to carry out the intervention or offer support to the client as you're carrying out the intervention. And depending on their ability to do so may guide your choice of intervention. And also you have to think about, do other healthcare providers have to be involved and are they able to carry out the strategy? Number five, how much time and effort are required to carry out this intervention? So you want to think about the amount of time and effort required on your part and the time and effort required on the part of the client. And you have to make sure that both parties are able to put forth the effort required to use the strategy. And then six, what are the effects of resolving this problem on other client problem areas? So you always want to keep in mind that, sometimes you resolve one problem and it betters other areas of the client's life. But there are times when resolving one problem could create new problems or worsen existing problems. So you really want to think about the impact that solving this issue would have on the client's life. So the second model that we'll discuss for client treatment matching is the systematic treatment selection model. So in this model, the clinician selects features of client presentation or functioning. So these are client characteristics, things like their symptom severity and their readiness for change. And you pair those features with the treatment dimensions. So things like the therapist skill level, the therapist level of directiveness. And so you're pairing client characteristics with treatment dimensions to identify the best client treatment match. With this model, you also consider client predisposing qualities. So again, client characteristics like their particular problem, their personality, their environment, and environmental supports. You'll consider the context of treatment. So the the setting of treatment, the mode of the treatment. Is it individual? Is it family? Is it group? And the format of the treatment. And you'll also consider things like the therapist activity and relationship. So the therapeutic alliance, the relationship factors, and therapist client matching. So you're considering client characteristics, the context of treatment, and the therapeutic or therapist activity and relationship, and you're matching those things to find the appropriate selection of intervention for your client.